Okay, we're moving right along with our discussion of body structure and directional terms. We have to also look at the concept of body cavities. The body is divided into two major cavities. We have the dorsal, which is the back cavity, and the ventral, which is the front cavity. Now, these are two major cavities. Things break down, of course, in smaller units from here. And let's keep in mind that cavities are hollow spaces that contain internal organs. One of the things I wanted to point out here about the suffix centesis, when I mentioned that was a surgical puncture, what I mean to say is when they do a centesis, they're going into a body cavity and usually through the cavity and into an organ. That's the very reason for that sterility, that absolute necessity for sterility. You do not want to introduce anything infectious into a body cavity. Looking at them a little bit more closely here, we see the illustration of the dorsal and the ventral cavities. The dorsal, of course, is the posterior, and it really has two smaller cavities, and that's all it consists of, the cranial cavity and the spinal cavity. So you probably already know, since you probably have some idea of basic anatomy, the brain is included in the cranial cavity, and in the spinal cavity, it's the spinal cord. You can think of the dorsal cavity as a way that the body protects our central nervous system. It's in the brain is encased inside the skull, which is very dense bone and very protective. In fact, the most important part of the brain, the one that keeps our body functioning, is located in the center of the brain. So it's the last and least likely to get damaged from trauma, although it can. And then, of course, the spinal cavity on top of that, that's the descending spinal cord as it goes down the spine and radiates nerves out and through the body. So this is really your central nervous system, if you think about the dorsal cavity. The ventral, this is the front cavity. So here it's on the anterior of this lateral view that we're looking at. It has three, potentially four, and we'll discuss that fourth one in a moment. It has at least three listed here, cavities, or subcavities, if you will. We have the thoracic cavity, so this is the chest. And in here, what do we have? We have the cardiopulmonary system, the heart and the lungs. They work very closely together. And so the fact that they're, contained within the same cavity makes logical sense if you think about the design of the human and how we've evolved. Of course, other structures go through there, dealing with the vascular system and digestive system. The esophagus, for instance, passes through. But primarily, the thoracic cavity is about your body collecting oxygen and getting it into the bloodstream and then pushing it out to the bloodstream to get oxygen to the rest of the body. Beneath that, you have the abdominal cavity. So that's the upper half of this lower cavity you're seeing here. And that's our metabolic system primarily. So we're looking at stomach, liver, pancreas, gallbladder, all the things we need to digest food, essentially. And some of those organs will then also lead down into the pelvic cavity, especially the digestive tract. So the colon, meaning the large intestine, the small intestine, parts of those are in the pelvic cavity. So you think of dorsal as being central nervous system and ventral as kind of being cardiopulmonary, the metabolic system, and of course pelvic cavity also has the reproductive organs. Our combining forms in dealing with body cavities are cranio, which means cranium or skull, spino, which refers to the spine, thoraco, which refers to the chest, abdomino, which refers to the abdomen, and pelvi, which is the combining form, for pelvis. Two things I want you to note here. The second from the last word, abdomino, if you note on the right, our common vernacular, in other words, the speech that we use daily, we spell the word with an E-N at the end. However, in medical terminology, it's an I-N. So do pay attention to that. That will be significant on certain exams, possibly the one for this week. So the spelling of abdomino is the first thing I want to point out. It's I-N in medical terminology, E-N in our common language. The other is our first anomaly combining vowel, pelvi. So this is the first time you've seen it other than just being told it's out there. So pelvi, of course, refers to pelvis. The asterisk is just meant to bring your attention to that word and note that it is a different combining vowel. So our body cavity terms, if you take all those and put them together with some suffixes, we have cranial, pertaining to the cranium. Spinal means pertaining to the spine. Thoracic, pertaining to the chest. Abdominal, pertaining to the abdomen. And pelvic, pertaining to the pelvis. So here you are. They're all pertaining to they are all pertaining to suffixes. There are your words. You can see how they've been used. These suffixes are specific to these body parts, so this is the way you're going to want to learn them. And another note at the bottom, be careful on the spelling between abdominal, which is the medical version, and abdomen, which is the common vernacular or the common language we would use. Now, that fourth cavity, it's kind of a gray area. Let's address that. Here we have abdomino. We're going to combine it with pelvi, but the I has been taken away because we're going to put the suffix ic on the end. And if we think of our word building rules, ic starts with a vowel. Therefore, we don't need the combining vowel from pelvi to attach it. That's why it's been taken away here. Put all that together and we get a word that is pronounced abdominopelvic. This is pertaining to the abdomen and the pelvis. The abdominal and pelvic cavities are referred to as the abdominopelvic cavity. And that is true. They are referred to it often. Typically, it's sort of that gray area between the abdomen and the pelvis. And the reason it's a gray area is there's no distinct border. The dorsal cavity has distinct borders. It sits off by itself. Thoracic cavity has a separation of something called the diaphragm in between it. It's a muscle that we use to breathe. So that separates thoracic between abdominal, but there's no natural barrier between the abdomen and the pelvic cavities, or the abdominal or pelvic cavities rather. So we have this term to describe that area. However, you can use it to describe the entire cavity as well, and it's perfectly acceptable. Diaphragm, just mentioned it a moment ago, that's that line you see between the thoracic and the abdominal cavities. You're not going to be tested on this word, so just some brief information. It's a dome-shaped muscle, separates thoracic and the abdominal pelvic cavities, and has an important role in breathing. Essentially, when the muscle contracts, it pulls the lung fields down. Air enters the lungs. When you breathe out, it relaxes and it rises and it pushes the air out. Its combining form, although you won't be tested, but if you want to know, happens to be phreno, spelled with PH. And a phrenospasm is that sensation you have of not being able to breathe when you've been hit in the diaphragm. We often, it's a gut punch, I guess you would call it, or you've had the breath or the wind knocked out of you. If you've ever had that sensation, highly unpleasant. It was a phrenospasm, and thankfully it lasts a very short amount of time. Okay, now we have another way of subdividing the body. So now we've talked about directional terms. We've talked about body cavities, at least the major ones. Now we're going to look at something called quadrants. Nurses, medical assistants, anybody who's going to do assessment on patients is going to be using these quadrants because it tells us what we need to know about what organs are in which quadrant. I know that sounds kind of weird, but that's how it came out. We're looking at these quadrants to identify what might be going on with the patient. The list is on the right, and it has its accompanying abbreviation. Right upper quadrant, RUQ. Left upper quadrant, LUQ. Right lower quadrant, RLQ. Left lower quadrant, LLQ. It's always the direction first, either right or left. Then the second word will always be upper or lower. And the third word's the easy one. It's always going to be quadrant. Breaking these down, if we were to look at the right upper quadrant, and remember this is anatomical position, so this is the patient's right upper quadrant, not as you're looking at them, but as they experience it. So if you were to think of yourself, this is on your right-hand side. If the line goes through the belly button and down the very midline of the body, it's that upper right quadrant over where your liver is located, or at least the right lobe of the liver, along with the gallbladder, pancreas, part of the colon, part of the small intestine. It is the most common quadrant for patients to come in and complain of pain, often secondary to the liver or a gallbladder issue, sometimes pancreatic issues, could be colon, could be small intestine, but the first three are the most likely items when you're talking about pain. If that pain is deep, if it's superficial, it could be just a spasm of a muscle, it could be a spasm of the diaphragm. In the left upper quadrant, so go directly across from there, you have the left lobe of the liver. So as you can see, that purplish organ at the top of the abdomen. I don't know if my mouse will illustrate it, but right in there, if you can see that, that's the liver. And you can see it does move over into the left upper quadrant. Most people think their stomach is in the middle, but it's not. Your stomach is right here. And I've done many fluoroscopic studies with patients regarding the stomach, and it indeed is on the left side of the abdomen. We often think of it as the center, not anatomically correct. Beneath that, we have the spleen, kind of behind and beneath it. We also have the tail of the pancreas, once again, part of the colon, part of the small intestine. If you come with pain in the left upper quadrant, these are some of the organs we'll be thinking about and considering if the pain's deep. Once again, superficial, might just be a muscle spasm. The right lower quadrant, RLQ, this is probably the secondary spot where we have pain complaints. If you had to list them, right upper, right lower quadrant, that right lower quadrant has the appendix. So if you've ever had an appendicitis, which is inflammation, or have seen someone with it, it's very painful, and that's where it's located. Of course, the only other structures we have that are really prominent are part of the colon and part of the small intestine. You do also have something there called the cecum, and that is the organ that is the transition between the small and large intestine. We don't talk about it here, but you will definitely learn about it in anatomy. So these are the quadrants that we use to describe pain in the body. We have one more to look at, and that is the left lower quadrant. This has the least diverse amount of organs. It's really part of the colon, part of the small intestine, of course, leading into the rectum and the anus. So left lower quadrant is probably the least likely to be a pain complaint, and if it is, many times it comes down to simple constipation. Not that that's always a simple thing, but it's a common thing. So if you have, or if you or the patient should have pain down in that region, that's probably what's going on. One caveat to any of these things when we talk about pain in these regions, if any pain of the abdomen is associated with fever, it's something that does require a medical attention. It could be a form of sepsis, which could be an abdominal infection. It could be something more serious going on. Abdominal pain in and of itself, if it's severe enough, does require evaluation by medical professionals. If it is accompanied by a fever, I would suggest an urgent care or the emergency room just to make sure there isn't something more serious going on. And of course, severe pain in the right lower quadrant, especially if it goes away when the knees are drawn up towards the abdomen, is most likely appendicitis, and that does require emergency medicine. So if it's in the right lower quadrant or any quadrant and there's fever accompanied, please seek medical attention. If you're the attending, if you happen to be the MA or the nurse, then you'll know your protocols and know how to treat that patient. Okay, there's the quadrants. I'll be back in a moment to talk to you about body regions.